There's something beautiful that happens when a woman reaches her 50s. She's more confident, more aware of who she is, and often more free than she's ever been. Yet so many questions about intimacy at this stage remain unspoken, buried beneath uncertainty or embarrassment. Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon. And if you ever face questions or concerns about your urological health, stay with us. We're here to help you understand your body with clarity and comfort. Today, we're going to have an honest conversation about something that affects millions of women, but rarely gets discussed openly: intimate health and relationships after 50. We'll talk about what changes, what stays the same, and most importantly, how to maintain a fulfilling, intimate life during this beautiful chapter. Make sure you stay with me until the end, because we're going to address some of the most common questions I hear in my practice, questions that many women are too hesitant to ask their own doctors. Let's start by acknowledging something important. Your body at 50 is not the same as it was at 30, and that's completely natural. The transition through perimenopause and menopause brings real, measurable changes that affect intimate health. During this time, estrogen levels decline significantly. Estrogen is the hormone that keeps vaginal tissues elastic, lubricated, and healthy. When those levels drop, many women notice that vaginal tissue becomes thinner, drier, and sometimes more sensitive. Medical professionals call this vaginal atrophy or genitourinary syndrome of menopause. What does this actually mean for you? You might experience discomfort during intimacy that you never felt before. You might notice that arousal takes longer, or that natural lubrication isn't what it used to be. Some women tell me they avoid intimacy altogether because they're worried it will hurt. But here's what I want you to understand. These changes don't mean the end of a satisfying, intimate life. Not at all. They simply mean we need to approach things a bit differently, with more awareness and often with some helpful adjustments. Beyond the physical changes, there are emotional and relational factors at play. By 50, many women are dealing with life transitions, children leaving home, caring for aging parents, shifts in career or identity. Stress, fatigue, and emotional overwhelm can all affect desire and responsiveness. And let's be honest about something else. Long-term relationships sometimes fall into patterns. After years or decades together, some couples find themselves in a routine that lacks the spontaneity and excitement that once came naturally. This isn't anyone's fault. It's just what can happen when life gets busy and intimacy becomes less of a priority. The good news? All of these challenges have solutions. Understanding what's happening is the first step toward reclaiming intimacy and pleasure in this stage of life. Now, let me share something I see repeatedly in my practice. Certain patterns that unintentionally create distance between partners. These aren't about blame, they're about awareness. When we know better, we can do better. The first mistake is assuming nothing can be done. Too many women and their partners believe that declining desire or discomfort with intimacy is just an inevitable part of aging that must be endured. This couldn't be further from the truth. There are medical treatments, behavioral approaches, and communication strategies that can make an enormous difference. The second pattern I see is partners not adapting to changing needs. What worked in your 30s might not work in your 50s. If a couple continues with the same approaches, the same pace, the same expectations, without acknowledging that bodies and needs evolve, frustration builds on both sides. Let me be specific about something that matters deeply: preparation time. Women at any age typically need more time than men to become fully aroused, both physically and emotionally. After menopause, that timeline often extends even further. If a partner rushes through intimacy, focusing only on their own readiness without ensuring their partner is fully prepared, the experience becomes uncomfortable or even painful for the woman. I've had countless women tell me they started avoiding intimacy because it hurt. And when I dig deeper, I discover that adequate time for arousal and lubrication wasn't part of the equation. This is fixable, but it requires awareness, patience, and communication. Another significant issue is the emotional component. Women don't separate physical intimacy from emotional connection the way some men might. If there's tension in the relationship, If kind words and affection are missing throughout the day, if respect feels absent, a woman's body and mind won't be ready for intimacy no matter what the physical circumstances are. I've seen relationships where one partner expects intimacy to happen on demand without investing in the emotional connection that makes a woman feel safe, valued, and desired. That simply doesn't work, especially as we age and become more attuned to our authentic needs. There's also the issue of personal care and consideration. Basic hygiene, being well-groomed, and making an effort with appearance might seem superficial, but they matter. They communicate that you value your partner enough to present your best self. When that effort disappears, it can create distance. And finally, there's the trap of silence. So many couples stop talking about intimacy altogether. They don't discuss what feels good, what's uncomfortable, what they'd like to try differently. This silence breeds assumptions, misunderstandings, and missed opportunities for connection. One thing I cannot emphasize enough: hurtful words spoken during intimate moments leave scars that last for years. A woman in a vulnerable state, sharing her body with her partner, remembers every criticism, every comparison, every dismissive comment. If you want intimacy to remain a source of joy rather than pain, approach these moments with tenderness and respect, always. So what actually helps? Let's talk about concrete, practical approaches that can restore comfort and pleasure to intimate relationships after 50. First, let's address the physical concerns. Vaginal dryness and tissue changes are medical issues with medical solutions. High-quality lubricants are essential. I recommend water-based or silicone-based products that are designed specifically for intimate use. These aren't optional extras, they're necessary tools that make intimacy comfortable again. Beyond lubricants, there are vaginal moisturizers that you use regularly, not just during intimacy, to help restore tissue health. These work differently from lubricants. They actually help rejuvenate the vaginal lining over time. For women experiencing more significant symptoms, hormone therapy can be remarkably effective. Low-dose vaginal estrogen comes in creams, tablets, or rings that are applied locally. These treatments work directly on vaginal tissue without significantly raising estrogen levels throughout the body. Many of my patients tell me these treatments have been life-changing. There are also non-hormonal options, including newer medications specifically designed to address vaginal atrophy and discomfort with intimacy. The point is, you have choices. You don't have to suffer in silence. Now let's talk about timing and approach. Remember what I mentioned about arousal taking longer? Build that into your expectations. Set aside real time for intimacy, not just a rushed few minutes before sleep when you're both exhausted. Create an environment that feels romantic and relaxing. Think about what puts you in the right frame of mind. Maybe it's soft lighting, music you love, or simply knowing you won't be interrupted. These details matter more as we age, not less. Foreplay is not optional, it's essential. This includes both physical touch and emotional connection, gentle caresses, words of affection, taking time to genuinely connect before moving toward intercourse. For many women over 50, the entire experience of intimacy becomes more important than just the final act. And here's something crucial. You might need to redefine what intimacy means. It doesn't always have to follow the same script or lead to the same destination. There are many ways to experience pleasure and connection with your partner. Oral intimacy, manual stimulation, simply holding each other close, these all have value. When you release rigid expectations about how things should go, you often discover new sources of satisfaction. Let me address something specific that I'm asked about frequently. How long does intimate activity typically last, and does that change with age? Research tells us that for penetrative intimacy specifically, the average duration is somewhere between 5 and 10 minutes from beginning to completion. But that's just one narrow aspect of the entire experience. When you include the time for emotional connection, physical preparation, and aftercare, a fulfilling intimate encounter might last 30 minutes or longer. For women especially, reaching climax typically requires 15 to 25 minutes of combined stimulation. This can be even longer after menopause if the right conditions aren't in place. Understanding this helps set realistic expectations for both partners. The key is not to rush. It's to be present with each other, to pay attention to responses, and to prioritize mutual satisfaction rather than treating intimacy as a task to complete. Communication throughout is vital. What feels good today might be different from last week. Checking in with each other, asking gentle questions, and being receptive to feedback makes everything better. I want to shift now to something that affects intimate health in profound ways: your overall physical and emotional well-being. Sexual function is intricately connected to cardiovascular health. The same blood flow that's necessary for heart health is necessary for arousal and physical response during intimacy. If you're experiencing persistent difficulties, it's worth having a comprehensive health evaluation. Conditions like diabetes, high blood pressure, and high cholesterol can all impact intimate function. Many medications used to treat these conditions have side effects that affect desire or physical response. This doesn't mean you should stop taking important medications, but it does mean you should talk with your doctor about options. Lifestyle factors matter enormously. Regular physical activity improves blood flow, boosts mood, and increases energy. Weight-bearing exercise helps maintain bone health, and cardiovascular exercise supports the circulatory system that makes arousal possible. What you eat influences hormone levels, inflammation, and overall vitality. A diet rich in fruits, vegetables, lean proteins, and healthy fats supports intimate health just as it supports every other aspect of well-being. Stress management cannot be overlooked. Chronic stress elevates cortisol, which suppresses sex hormones and dampens desire. Finding healthy ways to process stress, whether through meditation, therapy, creative outlets, or time in nature, directly benefits your intimate life. Sleep quality affects everything. When you're chronically exhausted, your body deprioritizes intimacy because it's focused on basic survival needs. Protecting your sleep is protecting your intimate health. And finally, mental health. Depression and anxiety profoundly impact desire and ability to experience pleasure. If you're struggling emotionally, seeking support from a therapist or counselor isn't just good for your mental health, it's good for your intimate health too. Let me talk now about the emotional dimensions of intimacy after 50, because these are just as important as the physical aspects. By this stage of life, most women know themselves well. You know what you like, what you don't like, and what matters most to you. That self-knowledge is a gift, but it requires that your partner be willing to listen and adapt. Mutual respect is the foundation of sustained intimacy. When partners genuinely respect each other's needs, boundaries, and experiences, intimacy deepens rather than diminishes over time. I want to address something specific: the importance of what happens before and after intimate moments. How your partner treats you throughout the day sets the stage for intimacy. Acts of kindness, words of appreciation, helping with responsibilities, showing genuine interest in your thoughts and feelings, all of this creates emotional safety and desire. And after intimacy, the moments of holding each other, talking softly, staying connected rather than immediately separating, these aftercare moments communicate that intimacy was about connection, not just physical release. For women especially, this matters deeply. If intimacy has become difficult or infrequent in your relationship, it's worth considering couples counseling or sex therapy. These professionals are trained to help partners navigate sensitive topics, rebuild connection, and discover new ways of relating to each other. Many couples find that opening up communication about intimate needs leads to improvements in all aspects of their relationship. When you can talk honestly about something as vulnerable as intimacy, other conversations become easier too. Let me address a few specific questions that I hear regularly in my practice. Some women ask about natural supplements or foods that might enhance desire. While there's no magic solution, certain nutrients do support intimate health. Antioxidant-rich foods, particularly berries, pomegranate, and dark chocolate, support healthy blood flow. Foods high in omega-3 fatty acids support hormone production. Staying well hydrated helps with natural lubrication. Some women ask whether intimacy itself becomes less important after menopause. The answer is deeply personal. For some women, desire naturally decreases, and that feels appropriate for where they are in life. For others, desire remains strong, or even increases because they're no longer concerned about pregnancy and may feel more sexually confident. Neither experience is wrong. What matters is that your intimate life aligns with your authentic desires and supports your overall happiness and connection with your partner. Women also ask about physical discomfort during intimacy. If you experience persistent pain, please don't ignore it. Pain is your body's way of telling you something needs attention. It could be vaginal atrophy that responds to treatment. It could be pelvic floor dysfunction that physical therapy can address, or it could be another medical issue that deserves evaluation. I want to leave you with this thought. Intimacy after 50 can be some of the most meaningful and satisfying of your life. You have the self-knowledge, the confidence, and often the freedom from earlier life pressures that allow you to fully embrace pleasure and connection. The changes your body goes through are real, but they're manageable. The emotional depth you've developed over decades can make intimacy richer than it ever was in your youth. What's required is honesty, both with yourself and your partner. It requires a willingness to adapt, to communicate, and to prioritize this important aspect of life and relationship. If you're struggling, please know that help is available. Talk with your healthcare provider. See a specialist if needed. Consider therapy if emotional or relational factors are involved. You deserve to have an intimate life that brings you joy. Remember that you are not alone in navigating these changes. Every woman who lives long enough goes through this transition. The ones who thrive are those who approach it with curiosity rather than resignation, who seek support rather than suffering in silence, and who remember that their intimate well-being matters just as much at 50, 60, or 70 as it did at 25. Take care of yourself, be patient with your body, communicate openly with your partner, and don't hesitate to seek the medical care you deserve. Your intimate health is an important part of your overall health and happiness. Thank you for trusting me with these sensitive topics. And as always, remember to take care of yourself because you are worth it.